Welcome to another episode of Back to Back. I am Dr. Mark Moran, and this is our special guest traveling all around the world, Dr. Umal Ssenkubuge.
I promise you, we practiced that 5 times. Ssenkubuge.
That's what I said, Ssenkubuge.
That's what you're saying? You sure? We can replay it over there.
Have you ever seen the show Friends?
Yeah.
Okay, so remember when Joey was trying to learn French?
Yes.
Phoebe was like, "Je m'appelle," and he was like, "Je m'appelle Joey," and she's like, "Je m'appelle Joey," and he's like, "Je m'appelle."
That is such a funny show.
That is what I feel like when you're trying to teach me how to say your last name. Let's try it again. Ready?
Ssenkubuge.
Dr. Umal Ssenkubuge. That's pretty good.
You did well.
Do I basically speak Ugandese now? Is that the word, Ugandese? Ugandese is a word?
So Uganda has several tribes.
Okay.
The official language is English. Thank you very much.
Okay.
But that's Luganda that you're trying to speak. So
Okay.
I come from
So I'm basically fluent in Uganese.
Luganda.
I'm going to call it Uganese.
Well, they don't make you like us. This is the edition.
That's the real thing.
This is the Pro Max.
This is the AI.
Yeah.
This is the AI.
This is the trial version, the beta.
Okay.
We're not gonna get this thing done.
I know. Sooner or later we'll get it. We'll get down to business. Okay. So anyway, Dr. Umal Ssenkubuge.
Ssenkubuge. That's good. Proud of you, man.
I'm trying. Is a bariatric surgeon in Uganda.
Yes.
Right? And is actually blazing trails to try and establish an EMS system in Uganda because you guys don't have one, right? So consequently, he's over in the United States learning how to be EMS people, and he's going to take all that knowledge back to Uganda and make the world a better place.
You couldn't have said it any better. That's such an intro.
Oh,
I love it.
Thank you. And I'm going to go ahead and award you Best Dressed Guest of the Night.
I try. I woke up like this.
Nice. I literally wore these to bed. These are my pajamas every day.
But honestly, this is my daily life back home.
I know,
you would
you do
never
all the
catch
time.
me back home dressed like this.
I avoid buttons like everything. I don't do buttons.
It's impressions, first impressions. I'm trying to impress
You know
you,
what?
man.
Your first impression is really good. Very good. So welcome to the show.
Thank you very much.
Today
Mark,
we
for
are going to
having
talk about back pain, of course. We're going to talk about obesity, your specialty, not you personally, but what you practice.
me. Okay.
Right? And then we're going to see if we can teach the viewers a couple things, and we're going to have a couple laughs, and I'm going to be fluent in Ugandese by the end of this podcast.
You're doing great so far.
So far, I understand everything I'm saying.
Listen, I'm excited to be here. I'm excited. I look forward to our conversation.
Okay, so for our viewer, please tell us a couple things about you that we want to know.
I am from Uganda. This is how they make us 6 feet tall, all in muscle. They just joking. My name is Umar. My friends call me
Do you need help pronouncing your last name? Because I can pronounce it for you.
Ssenkubuge. Thank you very much.
Umal
my name is
Ssenkubuge.
Ssenkubuge Umar. I cut into people for a living, take away parts that they do not like, and keep the good parts. We give them shape. What we do is make people live happier, and happier is very subjective. So we help people prevent non-communicable disease progression, right? So if we catch you before you get sick, we'll help you. We'll walk that journey with you. I think helping is rather ambitious to say, right? So
Okay.
we will walk that journey with you to try and be your wellness partners. I think the best word is wellness.
Wellness is a good word.
That's what
really good word.
that's what my team loves to
That's
use.
right.
So yeah.
And so on a typical day in Uganda, like how many surgeries are you doing or how many patients are you seeing?
So that's a very other tricky question because where I come from, if you are a doctor, you are pretty much everything because of the lack of specialties that we.
So you're a basketball player too?
If that qualifies as a medical profession, I would be rich.
Are you an artist too? Are you a rapper? Can you rap for us right now since you do
I
everything?
can't say I rap, but I can speak some words. Does that count for? So yeah, we don't do surgeries every day. So we phase out. There's a process which starts with consultations. So we look at you come in just like a normal day. So we have days where we only do consultations. Then we have days where we do pre-op. And then we
Okay.
have operational days where we get to do most procedures. And then we have follow-up days.
Okay.
So it's a pretty busy, I wouldn't say business practice. It's a pretty busy practice because with pop culture and the Western world, people have learned that, listen, this is how I was born. And I don't have to put in so much work. If I can get the money, I can basically just go and buy a new body.
Yeah.
So it's such an interesting concept.
And you
around
guys
it.
don't have very much insurance over there, right?
Oh no, everything is paid out of pocket.
Everything's paid out of pocket.
Yeah, so insurance coverage in my country is about 0.5%. So
Roughly about 0.5%.
Well, let's say 0.5% of 45 million people.
Okay.
So that is going to give you, give and take, if the math is right, you're going to be around 250, 300 people that are insured.
Somewhere around there.
The rest of it is really paid out of pocket.
I have a trivia question for you. You ready?
Oh my God.
This is a Uganda trivia question.
Okay, that I can do because I just recently learned to play Jeopardy in class.
Jeopardy. Okay. I just looked this up to figure out if I knew anything about Uganda.
Let's go.
You ready? Okay. What is the obesity rate in Uganda? Do you know the Jeopardy theme song?
I will not know.
Take a guess. Take a guess. I'd rather you shoot and miss than never shoot at all. What's the obesity rate in Uganda?
It's going to be very low.
It is very low.
It's gonna even be less than 2%, if I could guess.
It's about 2%.
What's
It's about 2%.
What is it though?
It's about 2.3% is what.
2.3%?
Yeah.
Yeah. I know that because on my undergrad, I did my first research in malnutrition, and the numbers are shocking. We have more malnourished people than we do have obese people.
Oh yeah, I'm sure. Okay, so next question, follow-up question. So far, you're doing very well. You have 100 on your grade so far.
Okay.
Yeah. Okay. What's
That's a first.
what's the obesity rate in America?
I would go 15%.
15%? It's higher.
25?
Higher.
30?
Higher.
56%?
It's actually about 40%.
That makes sense.
The obesity rate in America right now is about 40% of Americans are obese. That's pretty bad.
That's one of the other shocking things that I've seen. One of the culture shocks I've seen coming into the United States. Of course, I've always come in and out, but coming and studying and living in the United States, one of the most shocking things I've seen is how out of shape people are.
Yeah.
And it's really the social determinants of health.
Right.
They are not as balanced. People are very comfortable here, for lack of a better word. And we can't really say comfort. We that's a sugarcoating word we use. But people have an abundance of everything here, whereas the scarcity that we have back home kind of prevents us from the extreme. So we both are living on the extremes. We need to find middle ground.
Okay, well, I'm going to give you a hint on this next question.
How am I doing?
Middle ground. So far, you're doing pretty good.
Okay.
Okay? All right. What is the obesity rate for American kids age 6 to 19? So it was about 2% in Uganda. It's about 40% for American adults. What's the rate, roughly, for kids in America between 6 and 19?
Oh, that's going to be even higher.
Maybe. I'm waiting for your answer.
35%?
It's about 20%.
20%? That's good.
Yeah. Well,
There's hope. That means there's hope.
the way I see it is 1/5 of kids are obese. 20%.
Okay, if you look at it that way, that's
4
not
out of 10 Americans, adults, are obese. That's bad. That's not good. Because we know there's all kinds of problems that come from obesity. I just read an article the other day about the leading cause of death in the United States, mortality is?
obesity,
It's cardiovascular disease.
which is secondary to obesity.
Which is secondary.
Yeah.
That's right. So cardiovascular death is still the biggest cause, and there's many factors that go into cardiovascular death or risk or disease.
Yeah.
One of them, which is obesity. So as we start to tie all these numbers together between what your country is like, 2%, okay, versus America, 40% of Americans, adults, are overweight. That's a problem.
That's a big problem.
Then you think about the next generation, the kids 6 to 19, 1/5 of them are obese. That's a problem. Because we know from a medical perspective, too much or excessive weight puts all kinds of problems on your musculoskeletal system. right? So I'm sure you understand that. Do you ever have talks with your patients about the consequences of obesity on musculoskeletal system or health as a general?
Absolutely. I mean, let me just get back to what you just said earlier. I am thinking, my head is going off right now, and it's going off in a good sense. Is you see how you're looking at obesity causing the pressure that brings to the human body, right? First pause it right there. But then there's the pressure it brings to the economy. That's another conversation.
Oh, yeah.
And I'm looking at it from the leading cause of death in America is cardiovascular diseases, which is non-communicable diseases. The leading cause of deaths where I come from is infectious diseases.
Oh, yeah.
And this is what I keep telling people, that one of the greatest innovations that America has given the world is the love for fast food. because now on the rise, if you look on the graph, on the rise, non-communicable diseases, specifically cardiovascular diseases, are on a rampage rise where we come from. And we are seeing it bestly because now fast foods have seen that there's a greater market where we come from. Now, where I come from, it's very prestigious for you to eat fast food.
I remember you telling me that.
For you to go to a KFC.
Very prestigious, like elite people.
That's what the rich people eat.
They go to fast food. Where do they go to?
Well, they go to KFC. They go to all these drive-thrus because of convenience now. Whereas in America, we see that as part of the biggest contributors because that's rather to the people that don't have as much. You know, that's what people that don't have as much, to eat because, man, groceries in the US are very expensive.
Yeah.
Don't ask me how I know that. So when you get the two factors, the two baselines, and then pick up the common factor, it comes to lifestyle.
Yeah.
Isn't that interesting?
Very interesting. You're right. I mean, Americans certainly have a tendency to go towards convenience, and they will pay for convenience.
Right.
They'll pay for people to deliver their food. They'll pay for deliver to people to have fast food ready for them. They'll pay for maid services. They'll pay for people to walk their dogs. They'll pay for all kinds of things because it's convenient, and they're choosing to go do other things instead.
The abundance we talked about. There's just because if you think about it, where I come from, I don't have money literally to live off, let alone to pay someone to walk my dogs. I'm gonna use that example to just put in some break a sweat, like I like to tell my patients, or I'm not gonna pay someone to deliver fast food for me because it's status. I am going to walk and drive, and then get it. It's very interesting, the different dynamics. But to come to the question, do I ever talk to my patients about obesity? That's basically what we do for a living. That's actually the core of what our practice is helping someone move this life journey together. We want to become your wellness partners. So we tell them about what you eat, how you eat it, when you eat it, what it's going to do to your body, and then how do you reverse it if it's not too late to be reversed. If you can't reverse it, then that's when we come in to do interventions. But the first point is that's where we spend most of our time. I mean, like, every first consultation is about 1 hour, and that's basically what we are talking about, to get to see what are your needs, what are your body needs, and what do you give your body. And we realize that people give their bodies more than what they need.
Oh, sure. So is this pre-surgery? This is pre-surgery.
Oh yeah, this is pre-surgery.
Because if a patient can do these lifestyle modifications and lose weight, they don't need surgery.
That's the hard work,
right?
though.
That is hard work. It's very hard. I deal with the same thing about if people can exercise or increase the range of motion of their joints or eat healthy or try to not be sedentary, they won't have as much pain. So it's very hard to get the patients to buy into what you're recommending. I totally understand that.
And it's so, again, like we were talking and saying the other time, we just relate that to a car, right? If you drive a car and you go 200 miles, 200,000 miles without servicing your car, the moment that car gets to break down, servicing is not going to help it. Right. You have to change the engine or the motor, like you guys call it. So that's the same analogy we use when we're talking to people about wellness and the human body. We relate everything to the car, to the everyday life, and then we have an hour's conversation about that.
I think that's a great analogy because we do constantly tell our patients, invest in yourselves. Don't wait till the very end to start taking care of yourself. You got to invest in yourself as you go through life and prevent the problems down the future. So I totally am on board with you on that. Totally agree. So we're talking about obesity. What are some things, or what are some causes of obesity?
Well, we will. Let's look at obesity this way. Let's look at it as what people want. No, but this weight is in my family, the lineage. This is in my genes, and I argue with them and I tell them, listen, I do not care what caused it or what it is. it can be reversed.
Sure.
So there are people that have genetic predisposition to it.
Yep, that's certainly a possible cause.
But most
Genetic predisposition.
most of it is most of people gain, whatever medications you're on, long-term medications, mostly steroids are going to increase.
Medications can cause obesity.
So there is also lifestyle. The biggest
Yep.
is lifestyle. This is the biggest problem,
Right.
is what we talked about, the convenience and regulating what you eat, how you eat it, and when you eat it.
Right. So inactivity.
Inactivity.
another cause, and poor diet
And poor dieting.
is
yeah.
cause of obesity too. Also, interestingly, poor sleep is a cause of obesity.
Absolutely.
Right? So that's very important for our viewers to know that just not sleeping enough can cause obesity. I think it's because if you're awake, you're usually just wasting time watching TV or not doing exercise, and then you start eating just from habits of eating and watching TV. I'm just guessing on that.
And people should also know that there's a difference between obesity on the scale and
Right.
overweight.
Right.
Right. So yeah, also rest if you don't, there's a hormonal play that comes into your body. Of course, there's,
Hormonal, yeah.
cortical levels going up.
High stress levels
High
can cause
stress
obesity.
levels. And then when people get pregnant, mostly ladies, there's a lot of hormones that come into play during post-pregnancy and during pregnancy.
Right.
But again, all that weight is reversible. And we can't blame weight, people that gain weight as a result of or postpartum weight gain to be obesity. That just doesn't count, right?
I agree.
So it's going to be, again, the biggest factor is going to be diet and inactivity.
Right.
The refusal for people to modify those two.
Perfect. So on that, what do you tell your patients? Is it better to just increase your activity and exercise, or is it better to have a healthier diet?
It depends on which level we find them. So
Okay.
where on the journey that we find them. In most cases, most of them come when you're pre-obese, so of course there's going to be a scale where
Sure.
there's no more accepted weight. Then there's going to be, of course, there's underweight. That doesn't qualify to this conversation. There's underweight, there's no more weight. There's going to be overweight, and then there's going to be obesity.
Right.
Now, depending on where on this scale that we find you, the interventions are going to be different. If we find you in obesity, chances are, how obese are you? There are people that are very obese. And so that way, even lifestyle modifications are not going to help you, because again, the outside is an indication of what is going on
Sure.
the inside, right? So much as we want you to shed off the weight, there's also other things that are going on in your body, like cardiovascular diseases and diabetes, that we have to take control over. So in most cases, medications come into place and surgery. But in most cases, when we get into people's life, these are people that are very cognizant of their weight. Oh, I'm going out of shape. So those are the people that we love. I personally love to work with, because one, they are willing, but because it's a pattern, it's a behavior, it is very hard for them to, to kind
Right.
of get off that track.
Exactly.
To start it. So we walk that journey with them and tell them, hey, let's give them knowledge. First of all, people will resist knowledge because now there's, Google, there's AI, there's what my friend did, there's all this kind of, I don't say misinformation, but what worked for Mark is definitely not going to work for me, right?
It's just different information. I would say
there's different unstreamlined information.
Right. And everything's kind of tailor-made to what you're searching for and your habits and everything. Certainly there's a bunch of misinformation along with good information. It's hard for the patients to weed through all that type of stuff.
So what we do is we first of all get their needs assessment, and then we walk that journey. At that point, hey, if you changed A, B, C, D, you authentically and honestly changing it, because one of the things that we see in this practice is lying. Patients lie.
Oh, trust me. Trust me. You're saying patients lie? Yes, I know patients lie about
which is like, I'm like, listen, you're gonna pay me anyway, so we could as well save you some money and time and do the right thing. So yeah, we do that journey with them and then talk to them about how do you change the lifestyle. That is the most hardest thing to do, because it takes a lot of unlearning, and as you might know, one of the hardest things to do is to unlearn, right? So if they are willing to unlearn, then in most cases they don't even progress to the medication and the surgical point. But then there are those that come into it, hey, I have a wedding in 2 months, I am 200 pounds, I need to get back to 100 pounds. Like, okay, there's nothing that is going to work unless let's go in and do surgery. And that's when you come in with cosmetic surgery, and that's what most people know us for, and the practice that we run for. But in most cases, it's the earlier that I talked about.
It's very interesting you say that patients need to buy into what you're saying, because I have a lot of patients that are hesitant or resistant to my recommendations. And you mentioned that, why are they going to pay you if they're not going to listen to what you say? I have that conversation many times with my patients, because it really comes down to trust.
Right.
The patients have got to buy in to trusting you 100%. If they're not going to trust you to do what's best for them, then they're going to slow down their progress. So imagine going to a financial advisor or somebody and say, are you going to do what's best for my money? You have to trust what they're going to do.
Right.
It's the same thing when you go to a doctor. You got to trust your doctors because they're trying to do what's best for you, and make sure you find a good doctor because, unfortunately, disclosure, there are bad doctors. There are doctors that don't have patients as their first priority. So you got to find a good doctor, and then if you do, trust them and listen to him or her when they say, these are our recommendations. You can get to your goal as fast if you follow recommendations, or slower if you want to doubt me and not really jump into the ship.
And this is what we tell them. We tell them, your health is really a partnership.
Right.
And unfortunately, or the unfortunate thing is that you get to play as a much bigger part than I do.
Right.
Because you are living with yourself most of the time. And this is what I tell my patients. I'm like, the right way to do fact checking is first hear the facts that I tell you.
Yeah.
Don't come to me with a list of template that you downloaded somewhere. Like, this is the fact. Then it ceases being the fact.
Right.
Does that make sense?
Sure.
Like, let me tell you, then go and fact check, as opposed to, no, I want you to do this. Then you are becoming the doctor. And that's actually one of the biggest problems that we face in our practice.
So I'm going to give you a phrase that I want you to use in Uganda.
Okay.
So it'll be spreading through the world.
Let's
and
go.
I can say this is going viral across the world. I tell my patients, we want you to be an active participant, not a passive recipient in your health. So the patients come in and say, what are you going to do for me, doc? I said, nope. I'm not doing something for you. You are going to be actively involved with your healthcare, and I'm going to help you be actively involved, but you're not going to be a passive recipient to what I'm telling you. You are going to be actively participating in your healthcare and your pain management. So that's what I think we should tell the patients is
be an active
participant, not a passive recipient of your healthcare.
That is so powerful. Now that you think about it, that is so powerful, because oftentimes it's that passiveness that actually got us into this place.
Yeah.
And this is what I always tell my patients as well. I'm like, I wish you came to us earlier.
Right. Yeah.
But because you are passive about it, then this is how we go. But hey, we'll be out of business if they didn't come.
Which would be great. Which would be great. But you're right. If people would come in earlier, it's much easier to treat something at the beginning stages than at the end stages when it's already progressed. So if someone came to you when they're 50 pounds overweight, you're going to be a lot more successful, and they will too, instead if they're 150 pounds overweight and they come to see you. It's the same thing with me. If patients come to me when they're 80 years old and they've had arthritis progressing for 50 years before they come see me, it's going to be a lot harder to get them better versus if they come to me when they're 30 years old and it's just all starting. We say, you're fine. We have a lot of time to work with this. Be an active participant in your health, not a passive recipient, and you can, instead of going off this way, you can start being a healthier person.
And that also makes me remember one of the things that we do tell our patients is that if you do not act now, you're going to have to do 3 times the work tomorrow. Totally. And remember, if you do not do it now, you're going to have to put X3 tomorrow. Right? So if we tell you, hey, come to us early, that feeling of pain that you feel could be something more than what you think. Make a trip to the doctor. It will be way cheaper. We can catch it earlier. More earlier than Google will catch it, because Google is going to just worry you, and we could actually have some facts and work around it. So I like the idea of be an active participant, not a passive recipient.
There you go. It's spreading across the world right now.
All right.
It's going viral.
I love it.
So we talked about some causes of obesity and the effects of that. Do you know some reasons or some ways to prevent obesity, or things you can do to prevent obesity? It's very basic stuff.
I think we just talked about that. First of all, be an active participant.
Be an active participant.
Break a sweat.
Break a sweat. Active lifestyle. That's right. What else?
Eat healthy.
Eat healthy. Healthy lifestyle is very important.
That is very important.
Right.
And there's a clear balance. And I'm going to ask you this about your practice. There's a clear balance about. So I keep telling people, losing weight is not much of what you eat. Again, it's the modulation, because if you work out more than you eat, surprisingly, you're going to gain weight. And you know this because when you see people go to the gym, and I'll give you a clear example. Someone goes to the gym, and I've seen this with most of our female patients. They will go to the gym at start of the year, mark out on a calendar, new goals, new me, let's go. Change diet, and then they start going to the gym. Well, they're seated behind their desk from 8 to 5. snacking in between, eating a heavy breakfast and doing all that kind of things. And then they go to the gym for 2 hours. They're on their phone for 30 minutes total. They're lifting weights. They are doing more burning of these calories that they accumulated during the day than they are actually. And then this is what their body thinks. Oh, we just depleted this amount of energy levels, because the body stores the energy, that fuel or the gas that runs your car, the body stores it as fat. So when you deprive your body of, the stores that have that, either from glucose, and then you go to the fat, the body is going to think just like your savings account would. I've depleted this. Let me fill it up. Right. And that's how you gain more weight, not knowing. So we tell them, be very careful when you're active, because then it's going to increase your basal metabolic rate. You're going to eat more because your body demands are going to be more. And in the process, you're going to be eating more frequently. Yeah. And that's how you end up getting more weight. So it's a very important balance that we tell people, hey, be very careful. And that's why it's important to go to a professional. Right. Because a professional will tell you what you eat and how you eat it and how you balance that with how much you
can't just stop eating.
You can't just stop eating, like you can't just keep eating.
And you can't just eat once a day. You got to balance it out, like you said. So it's a balance. So I agree with you. Another interesting thing I saw was have smaller plates. Right?
Yes.
So there's actually research that shows people that have smaller plates aren't as obese. So when you go to a restaurant or you go to a store, you buy plates at home, use smaller plates and you'll lose weight just from that. Mm-hmm. The other thing you mentioned earlier was get a dog, because dogs can be walked by you, not a service. Right. And the more you have to get up and walk your dog or go outside, the better
the more you're being active.
The more you're active.
Again, there is nothing like insufficient activity. The way the heart works is, the heart is one. I'm sure you know this, but I want to make sure that our patients or our listeners know this. The heart is it's actually one of the organs in your body that do not depend on your glucose levels, right? So the normal primary source of fuel that your body uses, the heart uses fat. And so I guess that's where the word cardio came from. When you tell people that, hey, I don't care if you walk, I don't care if you run, I don't care if you swim, we need you to move your body. Just move. Get into the act of moving. And walking a dog or a pet is a very, very good way to move it.
Right. And my patients that say, I can't start an exercise routine, I say, don't think of it as a routine. Think of it as one day. Go 10 steps one day. And then the next day, go 11. And every day, just increase it by 1 step or 5 minutes or 1 minute. But just start the activity of exercising and be consistent. You got to dedicate yourself to it. I'm not saying do it 5 hours a day. I'm not saying do it every day. I'm saying start the habit of going for a 5-minute walk. It's very simple. 2 or 3 times a week. And then as the weather gets better, you start building more energy because you'll build endurance. Then go for a 10-minute walk.
Right.
And you slowly build up on your endurance, and you'll see
it's a small habit. It's a small habit. You create a habit. You start on it, stay in it, and then before you know it, it gets onto you. Right. That's very important. Okay. I love it. And I think one of the things that we need to include onto that is one of the things that we tell you, again, patients back home, but also clients here, is get into the habit of consistency around you. Wake up at a consistent time. Do something. Get into a routine, kind of a routine. And also get a doctor. Get like someone that is going to know you. This business of hopping from this practitioner to this practitioner to this practitioner, that's how you end up, getting all kinds of... It's one thing if your doctor is not giving you results, or if your practitioner is not giving you results. It's the other thing if you stick in there and work with them. Because again, remember, this is a partnership that you've created.
It's a relationship.
It's a relationship.
And the longer you're in a relationship, the better off you feel.
The more I know you, or the more I know something about you, the more I'm going to give you better service. The more I'm going to understand your body. You've seen this where people that have worked with one practitioner for so long have seemingly better results. There's actually research. People that have worked with one practitioner for so long, if the practitioner is doing something right, they have way better results than people that do medical hopping from one person to another. Yeah. So that's also very important with information. So patients, just to reiterate, should find a good doctor and stay with them and trust them and make them part of their family, because that's what they are. They're trying to help them out for global wellness and health for the rest of their lives. Because things are going to change. I mean, things are going to change in the way you eat. Things are going to change in the way you consume. And your body grows. Your body is so dynamic. Right. Like the way Mark is not the way Mark was 10 years ago. I mean, I'm sure you were not gray. There's only one Mark. There's only one Mark.
Mark is constantly evolving. So the only thing constant is change itself. And so the way I understand it, correct me if I'm wrong, is you work here via internet in Uganda from like 8 p.m. to 4 a.m.
Yes, from about 6:30 p.m.
To 4 a.m.
So that's
okay.
No, from 6:30 p.m. that's my resting time. 6:30 p.m. Texas San Antonio time, almost like at 10, because then we are transitioning to like about 7 a.m. back home.
So you work from here, 10 o'clock here to 4 o'clock here, over there, through the internet, and then you slack off and take 2 hours nap.
About 3.
3, and then you get up, and then you go to your student job here to learn EMS from 8 to 5. Okay, and then you start all over again.
Yes. So this is the balance part of it. Let me tell it my way. Mark is just messing it up. So.
Another story. Mark's messed it up. That's fine.
So because of the time difference, there's a huge time difference, about a 9-hour time difference back home. So right now it's coming to 7 p.m. Texan time. So I would usually be asleep from like 5 p.m. up to like 10. Right? So 5, 6, 7, 8, 9, 10. That's about 6 hours.
So you're hating me right now.
Oh no, I am.
Do you think this is a dream or a nightmare?
Ask me tomorrow. And then I get up at around 10, guys are waking up back home, and then we do that. So I do that mostly if I have consults.
The bariatric surgery.
Well, it's more of consults.
Consults.
And then I go to bed at around, give and take, around 3:30, 4, depending on the day. And then I would be up at 6, and then I start my day here, and then that goes on. So I read just a good 7, 8 hours. It's just of the normal cycle of the everyday.
Because we learned earlier, sleep is very important.
Oh, I
for
sleep.
Obesity.
I sleep and I rest. I think so. There's a difference between sleep and rest.
Yeah.
Right?
So really, you're a full-time student and you're a full-time employee.
That's a life, baby.
Why do you slack off so much? I'm just wondering. You make me feel bad.
But the tricky part is, I think we talked about that. It's a balance.
Everything's a balance.
You gotta learn that. So one of the advantages of being in America is I'm very aware of what to eat and what not to eat. So I would regulate very much what I eat based on how not very cheap things are here. I would regulate how I eat. So I would eat a certain kind of portion certain times of a week, and then that's how I really catch up. Otherwise I would be not looking the way I used to look 10 years ago.
I remember you saying that food was very expensive here and you had to buy a lot less compared to back home. You could get a lot more that would last you for weeks.
Yeah,
right?
That's one of the privileges, I think, of being where I come from. The very many is that you get to, for example, $80, I would fill up an entire fridge.
$80
full of fresh groceries.
Fresh fruit, yeah.
Well, I don't know how much $80 would buy me here of fresh food, but I'm assuming that wouldn't be much. So, see, that's the reason I'm telling that I am very aware of what goes into the body.
It definitely wouldn't fill a fridge, that's for sure.
we certainly know it won't.
But do you like Chick-fil-A French fries?
I like chicken nuggets.
Oh, from
I
Chick-fil-A?
like the chicken. Yeah.
Oh, yeah. But do you like their French fries?
See, I have a problem with French people. And that...
So I would think you would like them because you're frying them, right?
No, I love fries. I just don't eat my chicken with watermelon.
Okay, so can we stay for our viewing audience? 2 out of 2 doctors approve of Chick-fil-A French fries. And we're talking about obesity.
We should get an endorsement from Chick-fil-A. They should watch this.
We're talking about obesity, talking about French fries. That's okay. Anyway, moving on. We're talking about obesity, and we're going to move into low back pain.
Yes.
I know a little bit about that.
I would want... Now, can I take over the interview?
Oh.
Can I just hijack?
Do we need to switch seats?
Can I just hijack?
Do you want to switch seats?
Because I really want to know. This is one of the most complaints that people that are overweight
I do
complain
consulting in Uganda from about 2 a.m. to about 10 a.m. every morning. So
a few hours now.
Yes, I'm ready.
I would want to know from a specialist, from an expert, what the relationship.
Let me find an expert.
What the relationship is with mostly overweight and obesity and back pain. What is it that connects those two?
Okay. That is such a good question. I'm so happy you asked. And it all comes down
I am seriously asking.
It all comes down to weight and gravity.
Okay.
So when someone is overweight, they have more weight pulling them forward and down with their lumbar spine.
Mm-hmm.
So instead of the spine being evenly stacked and distributed with the weight in the discs, it's pulling an anterior pressure towards their front, which causes disc problems, which then consequently causes facetogenic problems because they're putting more stress on their back because they're basically arching their back much more than they should be because the weight is pulling them forward,
Right.
which then causes arthritis. And it helps increase disc degeneration because they're compressing their spine much more than someone who isn't overweight. So someone who's overweight is compressing their spine, so they have disc problems. They're pulling their spine forward like a hyper arching back thing.
Mm-hmm.
So it puts more pressure on the back of their spine where their joints are, which causes more arthritis or accelerated degeneration of the joints.
I have had patients ask me, when you take away this fat, can you put it more in the back area than they have asked me to put it in the front area? That is just a by the way, but no one has asked me, and I keep asking, could that be the reason that we don't tell our body where to deposit most of the fat? We don't really get to choose. It will deposit in the biggest cavity. And what is one of the biggest cavities that we have?
Abdomen. Usually abdomen for men or thighs or breast for women is where
Makes
a lot
so
of
much sense.
excess weight goes. And so it just causes anatomic changes with gravity and stresses on the spine, which leads to all these other back problems.
So if I'm overweight, is it safe to say that I should walk with a stick, or do I just shed the weight? What do you recommend?
I would say shed the weight instead of keeping the weight and walking with a stick.
Makes sense.
But in the end, you want to be light and fast. So you want to maintain your ideal body weight. You want to maintain your joints by exercising and range of motion. And to do that, you need to not have excessive weight. It's like carrying around 2 50-pound dumbbells throughout your life. It's really, really bad on your joints. So you can lose a lot of pain or problems with pain by just maintaining an ideal body weight. And actually, in fact, obese people are 33% more likely to develop low back pain than people that aren't obese.
That's why.
Right. So just obesity by itself will increase your chances of developing low back pain.
So what would you like to tell someone out there that is obese with back problems, and they're telling, now I have arthritis problems, or I have spondylitis problems, and now I can't even exercise?
Right. Deal with that all the time. San Antonio has their fair share of obese people with diabetes and high blood pressure. But that's part of the situation we're in, and we're here to help. So I tell them, you have to be actively involved with your healthcare.
Right.
You can't be a passive recipient of your health. You have to decide to change your path. It's like you can keep on going in the direction you're going and things will get worse, or you can make a conscious effort to change the direction and change your habits. The example I give is, if you are on 1604 and you never turn and you're trying to get to Austin, you're never going to get to Austin. It just doesn't go to Austin. So if you want to make a change in your path, you're going to have to change the way you're going and take a road that goes to Austin. Right? If you get on I-10 trying to get to Austin, it's never going to happen. So you got to make changes to your lifestyle and your habits to get to where you want to go. And if you do want to be in a position where you're not having lifelong pain or increased pain or suffering because you can't do things with your kids or your grandkids because you're in so much pain, or the obesity is causing heart problems, or you're on all these medicines that treat high blood pressure and diabetes and all these other things, you're going to have to choose, that's not where I want to go. I want to go over here, so then make the change. Because nothing is going to change unless you change.
Well, Doc, I have another question for you. Well, I am on all this kind of medication, and my doctor told me I have to regulate the way I walk, how much exercise I do, because of my heart issues. And now here you are telling me that I have to be active, and on top of that I have a problem with my back. How do I go about that situation?
Well, baby steps. And I talked in the last podcast about make it 1st and 10, not 1st and 75. Do you watch American football? Right. So they get the kickoff. They start on the 25-yard line. The goal's 75 yards away. They don't make it 1st and 75.
Right.
They take a big goal and they divide it up into much smaller, easily accomplished goals. 1st and 10. So I tell them, just go 1st and 10. So we're going to lose 5 pounds.
Okay.
Okay? Let's see if we can do that. And you can get into water and walk in water and exercise in water, because the buoyancy will take a lot of stress off your spine and your joints to enable you to start building up an endurance so you can be active again.
Right.
And as you start to lose weight, you can start being more active outside the water. The best pools, if you really want to know, are those pools that have the beach entrances.
Mm-hmm.
Do you know what beach
Yes.
entrances are?
Yes.
So then as you're heavier, you can go deeper in the water and there's more buoyancy. And then as you lose weight and you gain exercise, you can come to more shallow and you'll lose the buoyancy and put more stress on your joints. Right?
Makes so much sense.
So then I say, okay, we're here for you. We're going to help you. We're not going to do it for you. We're going to help you, and we're going to have small goals to get you to where you want to go. You didn't get like this overnight. You're not going to get out of this overnight. It took you years to get in this situation, so we're going to plan to do this, but we're going to keep on heading towards your goal. We're going to put you on I-35 to get to Austin instead of I-10. That's never going to get you to Austin.
I really love that. I think the most of the problems that we see, I don't know about your practice, but most of the problems that we see is people have had this problem for 10, 15 years, and then they come like, hey, I only have 2 months to fix this, right? So what advice would you give someone that is into the business of quick solutions, quick fixes?
I would tell them that we can do as much as you want to do, but realize the shorter the duration you want to make changes, the harder it's going to be on you, which will increase your chance of failure. So you don't want to get a medical degree in 1 year.
Yeah, right.
It's too much work. You will fail. You're setting yourself up for failure. So make it a reasonable goal, and that's one of the things you do when you come up these. Not making it first and 75, but first and 10. You come up with a reasonable goal. Now I said lose 5 pounds. That's a reasonable first goal. That's not going to be your goal the whole time, because next month we're going to say, okay, let's see if we can lose 6 pounds. Or if you can't lose any weight, let's see if we can make you walk twice as far. Okay? Or if you can't walk, let's see if you can get in a pool and stay walking in a pool for twice as long. So there's different ways to modify their health problems that they're dealing with, whether it's obesity or pain or whatever else, to try and get them to, once again, be actively involved with their health care. But the shorter the duration, then the harder it's going to be. One of my other favorite sayings is, if you fail to prepare, prepare to fail. So if you're going to give yourself 2 months to lose 50 pounds and you've had years to try and prevent this, you're preparing to fail because you're failing to prepare.
Absolutely.
So when I do talks or lectures or do anything else, I'm very adamant about preparing because I don't want to look like an idiot. I don't know what I'm talking about. So I go and I prepare. So I'm not failing to prepare, because then I would prepare to fail. So it takes a little dedication. It takes a little motivation. It takes us helping them. We're helping. We're not doing it for them like you do with your patient.
Yeah.
But it's a team effort. And they didn't get like this overnight. It's not going to go away overnight. It's going to take a change.
And part of the team effort that I tell my patients is find an accountable partner.
Mm-hmm. Absolutely.
Find someone that is going to push you when you're slacking. Find someone that is going to get you back on track. Because it's again, like you said, it's a journey. It's not going to happen over time. You better have someone that is going to push you.
Another thing we like to say is knowledge is power. Knowledge is power. So the more you know about something, the more you can take control over that situation. And a lot of time patients have fear just because of ignorance. Not to say they're stupid, but because they just don't have the knowledge of what goes on with that situation. So become an active participant and learn what the causes of obesity are, what the cures for obesity are, or what you can do to minimize obesity, or what you can do to lose weight. So actively participate. Another thing is you can go to our website. It's onemonthmd.com, and you can learn about the causes and treatments and prevention of low back pain, and you could be an active participant in your health instead of a passive recipient.
Look at that.
Talk about all these things to help patients learn and use that knowledge as power to control their life and control the problems they're dealing with.
Again, it's one of those things that we say, your body is a composition of different systems.
Right.
Don't treat one in isolation.
Right.
Because here we are thinking, well, obesity is just a more of a shape-looking issue, and it's giving you back issues. So you have to put coolant in your radiator as much as you have to fuel up or gas up your car. Check on your tires. Make sure that the body is doing and the electric system is doing good.
Right.
So I like that.
Yeah. And an example I give many times, which my patients are probably sick of because they've heard it so many times, is patients come in and they say, you did a procedure and I'm still not better. And I say, okay, well, think about a car. If you had a car that didn't start and you took it to the mechanic and they said, oh, you're out of gas, you have a bad alternator, and your battery doesn't work, but I put gas in your car. Your car is technically better. You now have gas, but you still haven't addressed other things that prevent the car from starting. You still have a dead battery and you still have a bad alternator. So all those things will contribute to a symptom of the car isn't starting, but don't think it's one thing that needs to be fixed to solve the car from starting. It's multiple different things. So in the situation of dealing with weight loss or trying to eat healthy, it's multiple different things that are going to need to be done instead of just, oh, I'll take a pill and I'll lose the weight. No, you have to change your lifestyle. But it takes multiple things to do to make lifelong changes. It'll take 60 days to make a change become a habit.
Right.
But then after the habit is formed, then you continue to do it and you reap the benefits.
You couldn't have said it. Hey, you heard from the expert. He could not have said it better.
Very good. Did you have any other questions for me?
I think I've earned my money's worth.
Oh, yeah, you definitely have. Are you going back to Uganda tonight because you're done with all American doctors? Who's your favorite American pain doctor?
I wouldn't say Mark.
Why are you taking so long to answer that question?
I wouldn't say Mark.
Like, do you know any other American pain doctors?
But there's a doctor that does back-to-back. That's the one.
Well, I'm going to put on my podcast officially, you are my favorite Ugandan bariatric surgeon. Dr. Umal Ssenkubuge.
That's Russian.
How is it again?
Ssenkubuge.
Yes.
You don't. This is the only one thing you don't have to be American about.
Okay.
Ssenkubuge.
Ssenkubuge.
See?
So, thank you very much for coming on. This has been very educational. I hope you guys learned something. I certainly learned a lot, and I appreciate your time.
I did learn so much from you, Mark.
Good.
Thank you very much for having me.
And we wish you the best of luck with your schooling and back home about starting something that will help out all Ugandan people.
Absolutely. And maybe sometime we can get a pain management doctor in Uganda.
I'm thinking about opening a satellite site just on Fridays.
Friday's happening time. We Ugandans don't do anything on Friday except for happening.
Perfect. That's what I'm going.
They just go dancing.
No, that's what I'm going.
That's how we deal with pain.
I'll have a site there. I won't see any patients. I'll just go dancing. I hope you guys learned something. Please check back for our next podcast. We appreciate all your help. Always send any emails to us because we want to answer your questions too. Thanks a lot.
Thank you very much.